Welcome back to Lemon or Lyme. Today, we're going to talk about these two organizations, the Infectious Disease Society of America, or IDSA, and the International Lyme and Associated Diseases Society, or ILADS. If you or someone you know is dealing with a tick-borne illness, these two organizations come up a lot. So, what is the significance and differences between these two entities? IDSA views Lyme disease as an acute infection. They do not recognize chronic Lyme disease. ILADS recognizes chronic Lyme disease. They view Lyme as an infection that can become chronic with persistent symptoms. IDSA only has one treatment option, which is one short course of an antibiotic. They believe Lyme disease can be cured with this short antibiotic course. ILADS supports longer-term or repeated antibiotic therapy, arguing that the Lyme bacteria, Borrelia burgdorferi, can evade treatment by forming biofilms, going dormant, or hiding in tissue. ILADS recommends individualized treatments, and they support combination and herbal therapies. IDSA is followed by mainstream medicine, hospitals, and insurance companies. ILADS is followed by Lyme literate practitioners and patient advocacy groups. IDSA works closely with the CDC and NIH, influencing public health policies. IDSA and the CDC influence health insurance companies who deny treatment coverage for tick-borne disease patients. ILADS works closely with Lyme literate practitioners and patient advocacy groups. ILADS offers alternative treatment guidelines focused on targeting multiple pathogens and individualized care. IDSA believes most cases are easily diagnosed and treated. ILADS recognizes Lyme as a complex and sometimes persistent infection. ILADS acknowledges that it can become chronic, especially if not diagnosed or treated early. ILADS emphasizes that co-infections may complicate a patient's case. IDSA still recommends using the two-tier testing protocol with the ELISA test followed by the Western blot test. IDSA does not recommend treatment for seronegative cases unless there is clear evidence like an EM rash. ILADS states that the standard two-tiered tests often miss tick-borne infections, particularly in early or chronic stages. ILADS suggests a clinical diagnosis, since the standard two-tier tests are unreliable and frequently inaccurate. ILADS does not recommend relying on the appearance of an EM rash, as more than half of patients never get a rash. IDSA has limited recognition of co-infections like babesiosis or anaplasmosis and does not acknowledge their role in chronic symptoms. IDSA also does not typically test for co-infections. ILADS emphasizes that co-infections are common and often overlooked, requiring separate or additional treatment beyond standard Lyme protocols. ILADS considers co-infections a key factor in chronic illness, stating they often complicate Lyme disease treatment. IDSA does not recognize chronic Lyme disease as an ongoing infection and believe persistent symptoms are due to post-treatment Lyme disease syndrome, or PTLDS, which they attribute to immune or neurological dysfunction rather than an active infection. IDSA believes post-treatment symptoms are due to unrelated health conditions, like psychiatric disorders. ILADS argues that persistent Lyme symptoms often indicate an active infection. IDSA is often criticized for being too rigid, underestimating Lyme, and dismissing patient experiences. They are also criticized for influencing health insurance companies. ILADS is criticized for promoting long-term antibiotics, which some researchers claim lack sufficient evidence and could lead to antibiotic resistance. IDSA focuses on controlled clinical trials and rejects treatments lacking extensive peer-reviewed research. ILADS argues that current research is biased towards acute disease and ignores chronic patients who have persistent infections. ILADS advocates for more research into persistent Lyme infections, treatment-resistant forms of Borrelia, alternative treatments, and improved diagnostics. ILADS and patient advocacy groups are seeking broader recognition of chronic Lyme disease. Well, I hope this clears up any confusion between IDSA and ILADS. Now that you know what these organizations believe, you can better understand how much they impact a patient's treatments, diagnosis, literally everything. If you have anything to add, please do so down in the comment section. Don't forget to hit the like button and subscribe for more Lemon or Lyme content.